This is the Alcohol Free Lifestyle Podcast, where you learn to live a life of health, wealth, love, and happiness.
Hi, everyone. Welcome to the podcast. This is Victoria English, head coach at Alcohol Free Lifestyle. If you enjoy hearing my podcasts, you can thank our guest today, because this guest is very, very special in my life. Dr. Stephanie Miller is part of the reason that I am alive today. Dr. Miller is the breast cancer program director at Rose Medical Center in Denver, as well as the Mountain Ridge Hospital in Thornton, Colorado. She is also the breast surgeon at Vail Health up in the valley. The last time I saw Dr. Miller, it was a very, very dark day, perhaps the darkest in my life. I've put out a lot of episodes, and there is a podcast from last year called My Darkest Moment at Age 47. And that was when Dr. Miller came into my room after my double mastectomy and shared that unfortunately they had found some live cancer in the tissue. Dr. Miller was able to get clear margins. If you're familiar with breast cancer or other cancers, you may know what that means. And it was a tough road. And so having her here today is hopefully an empowering experience for you, our listeners. We will discuss some perhaps uncomfortable truths around breast cancer and alcohol. However, at Alcohol Free Lifestyle, everything we do is to empower our listeners, our Project 90 participants, to simply make informed choices for themselves. And that's our goal today. We'll go ahead and get started. I may need a sip of my bubbly water because that got me really choked up. Thank you so much, Dr. Miller, for saving my life and for being generous with your time and sharing with our listeners.
Well, thanks for that really lovely introduction. And I do think it is quite serendipitous that our paths crossed again, because essentially it was just sort of a random meeting of myself with one of your clients on an airplane. And she spoke so highly of working with you. It had been life-changing for her. And she just was completely indebted to the improvements that she had found while working with you. And our discussion quickly led to who she had been talking to. And lo and behold, we then ended up reconnecting, which has been really exciting.
It has.
And you're doing a great job of touching other people's lives and helping them reach success in ways that most of them don't think is quite possible. So that's really a strong message to be presenting.
Thank you. Thank you. Yes, we are both doing some good work in the world.
Yeah. And you asked me to think about the role of breast cancer and alcohol, as I think it is almost difficult to go through a week or two without reading some sort of news presentation about the impact of alcohol and potentially preventable diseases, and the presentation of alcohol as a modifiable risk factor, in particular with breast cancer. Mm-hmm. And I thought that was a very interesting point of conversation. And as you put it up, it's a difficult one. It's not one that people really want to have. I have many patients sort of looking for a smoking gun for their diagnosis. And granted, most of the time it's sort of too complicated to tease out one smoking gun. But the question is alcohol a contributor to increasing women's risk in developing breast cancer? And thus, would this be a modifiable choice that women are making that could then alter their risk of developing breast cancer over their lifetime.
Mm. I agree with that. When I was diagnosed in April of 2018, and I had no idea at the time that I was BRCA1 positive. Never occurred to me that I didn't have family history. Never occurred to me that I had been carrying around such a high risk of developing this very, very aggressive type of breast cancer. And when I began to learn of the research linking drinking, alcohol consumption, and breast cancer, I was very, very uncomfortable. And
Yeah.
again, I was like, well, maybe it doesn't apply to triple negative because I had BRCA1 and things like that. The truth is, there just isn't enough research, like you said, to really find one smoking gun. And part of the reason I'm doing this podcast is because I'll never know if my drinking history had anything to do with my diagnosis. Yes, I was born with a high risk, and I'll never know. Did alcohol contribute? Did it raise it? Was that the thing that put me over the edge? We don't know. And so if you're listening, again, there will be some uncomfortable truths in this episode. However, what if, as Dr. Miller is going to speak to, there are modifications. There are things you can do preemptively to hopefully lower your risk. Being that it is Breast Cancer Awareness Month, we're coming up on the end of it. Dr. Miller, could you speak to the importance of screening?
Yeah, I think that most everybody in my field would recognize that screening is our best tool for identifying women with early stage breast cancer, and that it's with screening and early diagnosis that we're making the biggest impact on mortality and overall survivorship. So our goal is always to increase women's awareness of getting screened. The United States Preventive Task Force went back and looked at some of their previous recommendations and have updated them to start at 40 to be more inclusive, because it was missing women with their previous recommendation of 50, and the recommendation has now gone back to 40 for general public. If you have a high risk due to family or other previous diagnoses, the recommendation would be for you to check directly with your primary care doctor, OBGYN, whoever that might be, to ask them. Or you can also call your local breast center if you're not sure, and they'll be happy to guide you. But currently it's 40, and every year thereafter. I always recommend to women to find a breast center where they have dedicated breast mammographers if possible. Go to the same place so that they can have the history of looking at your images, so they can see how this image compares to the ones that you've had previously. And then lastly, go somewhere where it's going to be convenient. The last thing that you want is that somehow it's inconvenient for you to get to it, and that's why you don't do it. And so screening is our best tool to identifying breast cancer early. So in October, we recognize that it's our month to sort of get that word out, but it's also really important to remember that breast cancer doesn't have a calendar and doesn't know what month it is. So regardless of what month it is when you might be listening to this podcast or when you're supposed to get your mammograms, it's important to get it at that time of year. Or perhaps there's another thing that will help you remember that that's the date that you should be getting your mammogram, then stick to it, because it's not just in October that our bodies develop breast cancer.
Absolutely. May I ask you a question? My experience, thankfully, I did start getting screenings around, I think it was around 45. And again, no family history. I did have dense breast tissue. And so I went in July of 2017 for my mammogram, and it was clear. Everything was fine. I was scheduled to go back the following July. March 30th of 2018, I'd actually just finished working out on my Peloton like I did just before this episode. Same bike, and got in the shower, and I felt something. And it just felt weird. I felt like that wasn't there. That wasn't there yesterday. I mean, I'm washing myself the way I do every day, and it just felt off. A friend's mother had gone through breast cancer, and thankfully I was going to their house for dinner. And I asked the woman, I said, "Can you feel this thing?" And she said, "You need to run, don't walk to your breast center." So it was serendipitous that happened. And thankfully I did, because it was already stage 2B, meaning it was pretty big. There were lymph nodes. And so what would you say to a woman who feels that thing, that they just, we know our bodies, we have those instincts. What would you say to that woman who says, "Well, I'll go next month, I'm busy, da 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 da"?
So I would exactly support the decisions that guided you to where you've gotten. If you feel a new lump or abnormality in your breast, that needs to be evaluated. And putting it off isn't going to make it go away. And sometimes you have to be your own advocate for something that doesn't feel right. And it's true, you can have a negative mammogram and develop an interval breast cancer. That happens. A mammogram is just a screening tool, doesn't pick up all breast cancers. We know that it's not designed that way. It's just will pick up many of them, pick up 75 to 80% of breast cancers, but that's not near 100%. And there will be interval change in a woman's breast during the time from 1 year to another. So if you feel a new abnormality, it's important to go get that evaluated. And what's really important is when you go is to tell the technologist. Sometimes people are afraid to tell anybody because they just want to wait and see. Well, some things aren't detectable on the mammogram, but they may be by ultrasound, or it may allow the radiologist to use other tools to better evaluate an area of concern. And so I always emphasize to patients, if you feel something new or different, I want to know about it because we want to explore it. And you want to tell the tech or whoever it is that when you are at the breast center so that they can look at that, not sort of like, let's see if they see anything. Because on the first test, they may miss something that would be really important for them to evaluate in a different fashion. And the other thing that's important is I tell women, it's important to know what your breasts feel like. Every woman gets worried. They're like, my breasts are lumpy, bumpy. It frightens me. And I'm like, I just want you to know what normal is so that you'll be able to tell if there's a change. Many women can't detect their breast cancers because we're able to identify them early enough or the breast cancer is deeper in the tissue. But there are plenty of women who do detect something new and different. And I find that those women who do that have helped us in identifying a breast cancer in the same way that a mammogram helps us identify a breast cancer. So sometimes we need to be our best tool for our own health as well, which is a little bit of a great segue to thinking about how we can best be our own advocates for thinking about how we want to approach certain modifiable risks that exist in our everyday lives.
Yes. Yes, absolutely. By the way, in our show notes for our listeners, I will attach a link to how to perform a self-breast exam. You can do it in the shower. It's not that hard. And as Dr. Miller mentioned, know your breast tissue. Everyone's a little different. And if you're aware of the lumps and the bumps and the differences, you're more likely to notice that change. And that's what happened to me because I did do my monthly, feels. And when that thing popped up, I knew it wasn't just my dense breast tissue. So I will attach a little guide on how to do your self-exam. If you are menstruating, it's recommended that you do it after your cycle. Yes, let's talk about modifiable risk factors. There's so much out there these days. It can be overwhelming to learn about what's in our food and what's in the water and what's in the containers we eat from and all of that. It can be overwhelming and can at times feel it's like it's out of control, our control. It's like, oh my gosh, even if I shop at Whole Foods, Sprouts, things like that, I still feel like, well, I guess part of it is what it is. So let's talk about those modifiable risk factors,
Yeah,
Dr.
I
Miller.
mean, you can certainly feel really overwhelmed with the impotency that we feel in our society.
Well said.
Because it's true. I mean, there are a lot of things that we don't have control in our exposures. But some we can, and the question is can we play a role enough of them to then have an impact on our overall life quality and our longevity? We think about things just as easy from wearing a seatbelt to putting on sunscreen to exercising. And now the difficult discussion comes up that we need to be thinking about alcohol perhaps in a different way than we did when we were growing up, when we were in college, when we were going out after dinner, when we were working or on the weekends, because our definitions and understanding of alcohol consumption and its impacts have become a bit more refined. And I think most people don't recognize that for women, drinking more than one drink a night can be seen as leading to heavy drinking. Drinking more than 7 drinks a week, therefore, would be seen as heavy drinking. Drinking more than 4 drinks in a setting, or 2, sometimes you'll see that as one setting, or 2 hours is defined almost to the point of binge drinking and heavy drinking. And drinking over 16 drinks is definitely seen as heavy use. But you might think like, I don't drink that much, but if you drink 1 or 2 drinks a night, you have a glass of wine, and then when you come home and then have another glass with dinner, and then you go out with friends and you get a cocktail, and then you share a bottle of wine at dinner, the glasses of wine add up. And then I think most people don't recognize the units of alcohol as they're defined, right? We'll see that when it's studied, a unit of alcohol will often be defined as a 12-ounce of beer, but 5% ABV. Well, now with all of our craft beer, it's really easy to pick up a beer with a much higher alcohol blood volume. And the same thing with spirits, right? They talk about a 1.5 ounce quantity of 40 proof alcohol. Well, that's changed. And our association with cocktails and going to cocktail parties has completely changed many people's approach to having a cocktail that they might not have otherwise had at the beginning of the evening, or drinking that and then having wine to follow. So I think that our understanding of what these volumes or amount or grams of alcohol, because it's sort of based on 14 grams of alcohol, come from, or that those are the definitions that are being used in these guidelines. I think the other hard part that people don't realize is that it is reflected by our alcohol blood volume. So as we drink, the amount of alcohol in our blood goes up. And if you drink more rapidly, that process happens faster because our body's intrinsic systems to break down alcohol can't keep up. And it's different depending on how large you are and how hydrated you are and how much sort of volume of blood you have per amount of alcohol that you consume. And that's defined as getting to a 0.08% blood alcohol volume. But as you get higher in your blood alcohol volume levels, you get to levels where you black out, or you become unconscious, or even stop breathing, which I think people don't realize. I mean, that's directly can be from drinking too much.
Mm-hmm.
And I think that's really important for us to understand, because there's no manual that comes out with drinking. There's no speedometer, right? As we
Right.
all have, how fast is too fast to be driving on this road? This is a windy road. That's
Mm-hmm.
too fast. And so I think just even understanding that these are the units that people are talking about can already start to help people think about their drinking in a different format that can inform, with that information, can start making better decisions about their exposure to alcohol.
Yes.
Alcohol is broken down in our body by our liver into substances that can be seen as directly carcinogenic. And so the question is, how fast is the liver able to keep up? Sort of conceptually, you'll see that sort of 1 drink per hour, hour and a half. But not everybody's liver works the same.
Mm-hmm.
Not everybody's drinking pattern is the same. And perhaps there are other medications that you may be on that may be impacting how your liver is breaking that down, and then how your body experiences those metabolites may have different impacts on everyone individually. So that can be challenging for us to understand as a medical community when we're trying to make studies, guidelines, and statements about conclusions that we're seeing.
That makes sense. And there are so many factors at play, many of which are not understood. And so when we bravely look at what is a serving of alcohol, I've on coaching calls, I've taken a wine glass and put 5 ounces of water in it, and everyone is shocked. It's tough to understand how much we were drinking when we were drinking, and this isn't the kind of thing. So people in our community often are saying, well, yeah, I drink too much, but I'm burning off the calories, and I drink lots of water, and I take supplements. It sounds like what you're describing is something that is not it's not quantitative, right? Or is it qualitative? You can't assess how to negate those things because you don't know enough about them.
Right. I mean, currently, I can't say that all those things that you've described doing are going to negatively impact the production, or I should say in a different manner, that what you're describing is going to be protective
Yes.
against the carcinogenic effect or the toxic effect of the alcohol byproducts.
Mm-hmm.
Certainly drinking helps because it sort of dilutes it out, but your liver still has to break down that alcohol and will make that byproduct. Certainly exercising helps with the caloric accumulation or the caloric exposure. It's amazing when you can drink enough that it can be seen as a major food group just based on calories alone.
Mm-hmm.
And we would recognize that doesn't necessarily have any nutritious component that's of value
Right.
to you. And so, yes, it's good to do all those things, but it's not clear from the information that we have that that will be protective against the carcinogenic risk that you are being exposed to.
I think that's important to emphasize, because so many people are doing all the things to hopefully balance it out, and when it comes to this, we just don't know. And perhaps if you feel like you are treading water or staying above water a little bit because you do have other healthy activities and habits in your life, which is good, it doesn't mean that you can insulate yourself from those effects of alcohol.
Denialism is one of my friend likes to talk to me about, and many other components of our lives, right? If we just
Yes.
don't look at it, maybe it doesn't really exist. But
Yeah.
that being said, there are plenty of studies that have shown sort of a dose relationship with increased risk of developing cancer once you pass that one drink a day. And I tell my patients,
Yes.
you can't just hold it all up for the weekend and drink 3 or 4 drinks, because that's then heavy drinking. So when we
Yes.
say we don't exactly know, the questions that aren't clear is, what is the pattern of drinking over a woman's life going to have on her risk? What is the pattern of binge drinking that she may have had while she was younger and perhaps went to more parties, or perhaps she's older and
Yes.
now going to more parties? What is that sort of higher exposure going to do at brief intervals for cancer risk, as opposed to just continuous risk? And when we mention sort of people allude to sort of Mediterranean style diet and drinking, that's a much smaller volume over a much longer period. So what does that mean if it's a lower volume, but that blood alcohol levels never get to those same higher percentages? And I think that is definitely an area where a lot of research is undergoing, because it would be great to best guide people about the modifiable risks that they are exposing themselves to.
Yeah. And for the listeners of this podcast, this can be really hard to hear, because number one, people listening to this podcast, with all the podcasts out in the world, chances are you're not a person who is interested in a 5-ounce glass of wine or 5% ABV beer. And so if you're experiencing some resistance or some emotion around this, I want to just reassure you that it's understandable, and remind you again that this is information meant to empower you. I can put myself back in my drinking days before I had cancer and imagine hearing this and go, oh my gosh, so here I am, I'm stuck in this cycle. And great, I'm going to end up giving myself cancer, right? So if you're experiencing some difficult emotions right now, I want you to understand that it's okay, and you do have a choice. These are modifiable risk factors, even if they feel really big and scary right now.
I think, you're pointing out some real hard truths, right? I mean, I think you're exactly right. Whenever I've been in a situation, you have one glass of wine, it becomes a lot easier to have the second glass of wine. And 5 ounces doesn't get you through your meal. And so you almost need to have a preparedness for how you're going to approach those situations. I think luckily, we are seeing the social world in which we all interact change. The options of non-alcoholic options are much more prevalent than they ever were before. I think the acceptance of choosing a non-alcoholic alternative is socially much more supported than it ever has been before. But I think sometimes it takes, as we were sort of talking about, a guideline or a workbook to help you be ready for those experiences. And what I've found is a lot of women aren't even aware of this association of the potential of their drinking playing a role with increasing their risk. But what I've also found is that when I go out and I'm not drinking, sometimes people are more intrigued by it conceptually, to have that conversation about why I'm choosing not to drink, which can be a very interesting conversation to have. And at the same time, I'm also finding there are more like-minded people
Yes.
out there as well. And again, as you put it, this is to help make you empowered and better decisions. And guidelines or goals are things that we strive to meet and different levels of success at different times.
Yes, yes. And if you are a listener who is finding yourself in that difficult situation of being on the merry-go-round and displaying some signs of alcohol use disorder, some, maybe the habit is moving into something more and things like that, certainly try switching out the alcohol for a club soda or a fancy NA alternative, knowing that if it doesn't work out for you, it's not your fault. You can want better health. You can want to reduce your risk of potentially developing breast cancer. And if you find that these modifications aren't working, it's not you, it's the booze. So it creates the cycle of craving and dependence. And what's the fun in having 1 5-ounce glass? Because at that point, if you're in that cycle, it's not giving you the desired effect. We're not drinking for the delicious taste. We're drinking to feed that craving. And so, as a woman who has been there and has had cancer and is now thankfully on the other side of both, I just want to invite you to lead with some self-compassion.
Yeah, I think you bring up another interesting point. I was sort of surprised in sort of some of my other preparation and studies, the data that sort of supports it takes several weeks, like up to upwards of 3 weeks after you stop drinking for the impact of your previous drinking to sort of be eliminated from your body. So, it's going to take a little while for you to potentially feel the changes that may come from alcohol avoidance. And this is really important in a lot of our menopausal women who have more pronounced symptoms because they're already experiencing some of the issues with menopause, right? They have sleep disruption. They have problems with having to urinate more at night. These things can be exacerbated by alcohol, which causes more sleep disruption, alcohol being a diuretic. And so if you're in menopause or perimenopausal, you may find that your drinking is actually making you feel worse. And I've had plenty of women and friends that I know sort of found that when they eliminated their drinking, a lot of their symptoms became more tolerable. I'm not going to go as far as to say that they went away, because I'm not going to sell you on that, but they were surprised by how much alcohol was exacerbating sort of how crappy they were feeling as they were going through menopause.
Absolutely. My personal experience was that I was developing an issue in my 30s. When I came into my perimenopausal years, it just seemed to get so much worse. I was always tired. Even though I worked out, I was bloated, and I was slowly, that creeping weight was coming on. I was puffy, cranky, not sleeping. I had night sweats. So imagine I'm going to bed after drinking 3 or 4 glasses of wine, and I'm sweating, and my cortisol levels are through the roof, right? All these things, your dopamine, your serotonin, your GABA, all those things that help you feel balanced are disrupted. And then you throw some hot flashes and night sweats on top of that. It can feel overwhelming. And now that I am postmenopausal, I had a hysterectomy during my treatment, and I'm 54. I would have been there anyway. It does come with a lot of challenges, and I can't take any hormones. I don't know if I would anyway. And I cannot imagine what I would feel like if alcohol were still involved. And so I have such compassion for women going through that.
But women might find some alcohol avoidance may help them feel better.
Yes.
Because I think we often turn to it as something that may help take the edge off, or especially as their stress in life changes. But they may find that way they may feel a little bit better with some periods or of trial of alcohol avoidance. We're all looking for ways to modify and improve how we feel.
Yes.
And this may be a tool for some women to consider and have an impact that they're not expecting.
Yes, and those are such pleasant surprises. And so, as Dr. Miller is saying, what if you do substitute 1 or 2 nights a week, right? Start there, and focus on those wins of, wow, I did sleep a little bit better last night. You may not at first, but hang in there. Or, wow, I'm less bloated. My eyes are clear. I have a little more energy. In our 40s and 50s, wow, my joints don't hurt as much. Those little wins can be enough to keep moving the needle in the right direction and find what works for you. And again, if that's not working out, it's okay. There are other options, whether it's our program or a version of it or something else. There are lots of options out there today if you find that it's not so easy to stick to it on your own. I think those are great.
And there's always tomorrow, right? Like today may not have reached your success in the way that you had originally started the day to, but there is tomorrow and the day to start, right? Each day gives us a fresh take and a fresh start.
Yes. And yes, that's a great point, Dr. Miller, because when we are in the cycle of drinking excessively, and then we've got this knowledge of, oh my gosh, we may fall into a black and white type of thinking. I have to do this right. I have to do this. Just keep trying. See what happens. Explore options. I call it the moving walkway. If you are on the moving walkway at an airport, even if you get bogged down by some things, you're still going in the right direction. And so just listening to this podcast, being brave enough to listen to this, is moving in the right direction.
Yeah, I think as you pointed out, what we're talking about doesn't necessarily always sound like something that you want to embrace.
No. No, it doesn't. It doesn't. And also,
I'm always wondering, how can I find that more chocolate doesn't empower me with all the things I'm looking for?
I was just talking to my daughter about that today. I said, I don't miss alcohol anymore, but I got to tell you, and I gave up gluten as well for my GI and all the things. And I said, I don't miss alcohol. I do miss gluten, but I can live without it. If it would be a deal breaker if I had to give up chocolate, that'd be it. I'd say, well, I might not live long, but I'm going to live well. And yes, if you need any participants for any studies you're conducting on chocolate
about the health benefits of chocolate, right?
I'm your girl. I'm there, and I've got friends who will come with me.
Yeah.
Well, let's talk about let's go to an uplifting topic. Let's talk about alcohol and breast cancer and medicine in the future. What gets you excited about the future in your field?
Well, I think ultimately what all this has shown is it's given us an opportunity to identify something that we could potentially have an impact in addressing. As you mentioned, there are a lot of things that we just don't have control over in our lives. And perhaps as we understand alcohol as a risk factor, and we can understand and define it better, potentially identify which groups are more at risk. Is that a definition or not? Or should we approach drinking differently than we have in one way or another? I think when we have that information, it allows all of us to make better decisions. It also gives us better insight into understanding how these processes within our bodies are occurring. And that always gives us more opportunities to develop better avoidance strategies as well as treatment strategies. I mean, ultimately, the best treatment is to not develop it at all. But if we can understand how these processes are working, it gives us insight to develop new treatment tools so that cancer no longer becomes a lethal event.
Yes.
Which becomes then really exciting for people in the field of cancer work. To have our patients survive our diagnosis is something that we're all striving for.
It is encouraging. I mean, gosh, just from when I was diagnosed in 2018, I know there have been advancements in triple negative. There are more and more women surviving that diagnosis and even living with the metastatic breast cancer. So there is hope. And I would imagine that's important for you in your field because, gosh, talk about dealing with hard things.
Oh, absolutely. My colleagues that deal with cancers that we are not as informed or aware of ways to make interventions that have such a profound impact on outcomes, I'm not sure how they can sort of balance it. You know, most of my patients survive their diagnosis and will go on to die from heart disease, as I tell everybody, because that's the bigger killer in this country. But that being said, it's how do we create this? How do we create remedies such that this becomes a non-lethal event?
Yes.
And being part of that entire process is really exciting, as well as sort of mentally stimulating because you feel like you can be part of something that's going to have an impact on women. And you're absolutely right. The field of breast cancer this year looks dramatically different than it did 5 years ago, a decade ago, 2 decades ago, not even recognizable from, half a century ago.
Isn't that something?
Which is really amazing. Yeah.
That is. And so, look, there's so many medical advancements. And sometimes people will say, oh, the world's gone crazy. The world is this. But I say, you know what? I'm glad I live in this time because I had access, because I did make it. It's not breast cancer like it was a few decades ago, or even back when I was diagnosed. Things have evolved.
No,
and so
things have changed.
There's a lot to be hopeful around. And again, for our listeners, some of this is tough to hear about. And there are options, there are paths. And so if you find yourself in that cycle of drinking and that's making you feel lousy enough, and then shoot, now I've got to worry about this. What if we reframe it and say, yes, this drug has created some impact in my life. Now I'm brave. I'm willing to take a look at some of this information, and I can do something about it. Because the same way that more and more people, women, are surviving breast cancer, more and more people are releasing alcohol. And we are one path to that. Obviously, if you're listening to this podcast, the invitation always stands to speak with one of our coaches and find out more about what we're doing. And maybe we're a match, maybe we're not. The important thing is action. And you are doing that right now simply by listening and taking this information in.
You do great work, Victoria. You do great work, and it should not be unrecognized.
Oh, well, thank you. Maybe one day we'll be on stage, I'll be coaching, and you'll be talking about surviving breast cancer, and we'll be the power duo. We'll woman it together.
That's correct, yes.
Well, I hope that we will have you back again sometime. This has been so informative and interesting, and I appreciate you breaking it down into layman's terms so that we can understand it and digest it.
Well, thank you for having me. Thank you for letting me participate and sharing some valuable information in how people make better decisions for themselves.
Yes. All right. Well, cheers to our health. Cheers to your health for our listeners. And until next time, take good care.
Thanks so much for listening. If you'd like to learn more about our stop drinking services, you can go to alcoholfreelifestyle.com. You can follow me on Instagram at James Swanwick. Our YouTube channel is at alcoholfreelifestyle.com/YouTube, or you can send me an email at james@alcoholfreelifestyle.com.